And this is called Province 3. So all the comprehensive cancer centers are right here. There is no cancer center outside this province. You know why? That's where capital city is. So it has a number of government cancer centers as well as private hospitals. 6 million people live here. 24 million people in the country have no access to cancer care. So that's exactly what I talk about, geographic disparity in cancer care. Unfair, totally unfair for patients who are outside this province. So this is where we are going to do this cancer center. This is the second most densely populated, in fact, it is the most densely populated state in the country, and second largest population in the country, with 5.5 million people living in there. This is how it is. So when you think about Nepal and Kathmandu or Mount Everest, the romantic feeling of how beautiful it is, the mountains and valleys and hills and kukuri and all those things, you think about. Get outside Kathmandu. This is what you'll see. This is the downtown of the city. How is that? This is how people live. Many of them are farmers. They raise goats. Look at this lady. But these are the people who have the same kind of cancer that we have here. They need the same kind of treatments. And they are actual people, actual humans. Unlike Kathmandu, this is how it looks. Unlike Pokhara, this is how it looks. It's not drastic. So, before I went there, this is their hospital. So they decided to paint it to welcome Dr. Shah. So it looks nicer, right? This is how it looked after it was painted. This is their waiting hall, waiting area in the hospital. And because Dr. Shah was coming, they decided to put this thing. So the less sun. These are the healthcare volunteers and few nurses. This is their medical record system. All right. This is a physician who is taking care of a patient. Me seeing some of the patients there. And this is their pharmacy. And they were advertising that when I was there, we would have free health camp. I would be seeing patients there. Health records. We ended up seeing 618 patients in 2 days. So what do we want to do? We want that to change, and that must change. So we are going to create a state-of-the-art cancer center that is affordable, easily accessible, and that can take care of the patients there. Now, if you look at Nepal, right? North to Nepal there is China, and south to Nepal there is India. So India has around 28 or 30 states. So the state it borders is called Bihar, 100 million population. 100 million population, and no comprehensive cancer center. Can you imagine? A state in India, 100 million people, no cancer center. So when we have this cancer center right here, it is going to serve people of Nepal as well as in India. So what we did, these were their leaders, the city officials. This is how they are. I love their smile. Despite all this sun and heat and all that, they still are happy. So at a meeting with them, we signed MOU, and this is our plan. by the end of this year, we will have palliative care and preventive oncology. Dr. Walker is going to go there on December 1st, and he is going to train folks there. We are going to develop lab and outreach and all that. Next year, we will be doing chemotherapy, surgery. We will strengthen the laboratory radiology services. And 2021, we will have RADONC, and that's when we're also planning on looking at establishing stem cell transplant center, similar to that was done in Kathmandu. We have an advisory committee, number of doctors from the United States as well as in Nepal. Many of these doctors, you will see, they are originally from Nepal. They are training here. We recently hired this doctor in Nepal, so he is going to provide preventive oncology as well as palliative care services. He is an MD-GP. He is currently training. These are 3 physician leaders in Nepal who would be helping us in terms of organizing this whole cancer program. Our plan is to start the palliative care and preventive oncology on August 15th. So today is 4th, right? 11 more days, we will have palliative care services available there. The land was donated by the city of Gopalpur, and we'll be signing an agreement with the San Francisco-based architectural firm to design the hospital as well as cancer center. This is a construction company in Nepal, and they are going to help build the whole cancer program. We also decided to change the way medical record works. So we decided to create our own medical record system. It is called BTF Connect. It will not have meaningful use, which may not be meaningful even here. So we are going to have volunteers providing services in Gopalpur. A number of physicians and nurses from Seattle area and different parts of the United States are planning on going there on a regular basis. We talked about Dr. Walker, and this is exactly what I want to see on the faces of people there. Thank you. If you have questions, I'll be
I'm the Binaytara Foundation's Outreach Coordinator. Let me just open this really quickly. So, I get to work with volunteers, talk to people about our mission, and I organize our charity events. That's my biggest job. However, my job today isn't to tell you about those things. My job today is to ask you for your help. Dr. Shah has a statement that he likes to use pretty often. So it says, countries have man-made borders. Humanity does not. Now it's a statement that's hit home to me since joining this organization. You see, we build these borders around our countries, around our states, around our cities, our jobs, our families, our friends. Our borders are secure within, our walls are secure within these borders that we create. Which brings me to another quote. The only true borders lie between day and night, between life and death, between hope and loss. You see, with your help, we can do our part to minimize these borders between life and death. Why is it that you became doctors, nurses, researchers, pharmacists? Why is it that you became interested in medicine? To give hope to those who otherwise wouldn't have any. As you heard from Dr. Shah, the Binaytara Foundation's Cancer Center in Southeast Nepal is our newest, most ambitious project yet. So we ask that you join us in giving the people of Nepal hope. Hope for life after cancer. Hope of seeing their friends, their family members live longer, healthier lives. We ask that you make a donation, whether it's $10 or $10,000. We ask that you give what you can so we can give all that we can. If you have any questions about how to donate, please come find me. You guys will see some envelopes on the tables if you want to donate in those and give those to me. That's awesome. We also have a couple programs that we're introducing right now. If you do raise or donate $10,000, you can actually go with the Binaytara Foundation to Nepal in December. If you want to take your gift a little bit further, you can also, basically, you can fund a section of your choice in our Nepal Cancer Center, and that section will be named after you or a loved one. Truly, everything helps, and we can't do it without you. Thank you.